for inviting me to meet with the coaches here at New Frontiers. I'm always excited to, try to provide education and support for folks who might be in some ways, addressing issues related to substance use. And in this case, with young folks with executive functioning issues who may also be self-medicating or utilizing substances. So I have a few things. I have some slides which I want to go through. I also was given some questions which I did prepare some answers for. I think they were questions that were generated by some of the coaches at New Frontiers. And then, of course, yes, at the end, we can ask other questions, and I will try to be as helpful as possible there. So if you'll indulge me, I have about 10 slides, and then we'll get to the questions. Um, so just just so everyone knows, right, the New York Center for Living is an outpatient program. We work with adolescents and young adults, as well as their families who are experiencing substance use disorders, as well as mental health and learning challenges. Our program encourages abstinence from all substances, including vaping and nicotine, and recommends engagement in recovery-oriented systems of support. So those are things like 12-step and other programs out there that utilize peer support. We believe that substance use disorders are a family issue affecting each member of that system, and our interventions focus on both individuals in that system and the system as a whole. Fundamental to the work that we do and fundamental to work with substance use with young people is working with their families, particularly parents. Parents are vital for helping to shape and create boundaries and expectations for kids that can lead them towards brighter futures. And that includes either avoiding or mitigating substance use or getting them to treatment as necessary. So we do a lot of work with the family here. A brief overview of services. We provide psychiatric evaluations, individual therapy, group therapy, and family therapy. We provide ongoing psychiatry, medication management, and what's called medication for addiction treatment. Peer recovery services are very important. We do urine drug screening so we can get an objective measure of whether people are using or not and at what levels. And we effectively collaborate with outside providers like you folks. We have absolutely engaged with executive functioning coaches and tutors in the past as a large care team to support young people and their families. And so to the extent that we ever share a case, know that we will be great partners in that process. So I want to just talk about substance use disorders and what they are. The Diagnostic and Statistical Manual, the DSM-5 of the American Psychiatric Association, looks at 4 criteria to define substance use disorders. The first is impaired control over use, so consuming the substance in large amounts and for longer periods, unsuccessful reduction or cessation efforts, time spent seeking the substances, which is to say a disproportionate amount of time seeking substances and having that increase, and then the presence of urges and cravings for using of that or many substances. Social impairment impairs the ability to fulfill obligations. So that can be for young people, education, extracurricular activities, engaging with family. For adults, that can be similar things, but also, employment and other adult responsibilities. Use despite social interpersonal problems. So people have said, hey, we don't want you using anymore. When you use, we don't like who you are, and yet you're still doing it, even though it's creating social interpersonal issues. And reduction in adaptive activities in order to use. So somebody who loves playing pickleball on the weekends, who now is using that time to use substances and often alone, shows that there's a level of social impairment there. Risky use includes using in unsafe environments or where that use makes you unsafe. So that could be being in very dangerous areas to acquire or use substances, but also can be becoming so impaired by the substance that you find yourself in a unsafe place, like on the subway at night, passing out. And then negative effects to health. So a classic example is folks who have liver issues, including cirrhosis, who might continue to drink alcohol. Pharmacologic includes increased tolerance in the presence of withdrawal. So you need more substances to get you high or otherwise impaired, and then when you're not using for a period of time, you experience withdrawals. So those are the 4 criteria and areas that we look at. So NIDA, which is the National Institute of Drug Abuse, which is part of the NIH, the National Institutes of Health, defines substance use disorders as treatable mental disorders that affect a person's brain and behavior, leading to their inability to control their use of substances like legal or illegal drugs, alcohol, and medications. Well, many factors impact the development of a substance use disorder, and while there are many ways to interpret substance use, the medical and disease model of substance use disorders emphasizes the treatability of substance use disorders. This is really key because we're going to talk about stigma here in a moment and the stigma that we have to address when we think about people who use drugs. Um, and substance use is not a moral failing or a lack of willpower. It's a treatable condition with a number of contributing biopsychosocial factors. The medical model can be used to create stigma. At the same time, there's a way to interpret substance use like any other treatable illness that we experience. That's not a matter of our moral failing or our lack of willpower, but rather that we have a medical condition that can be treated and treated medically. There's a way in which in that lens and in that frame we can destigmatize substance use, and that's really key because as we address it, and we want to address it clearly and we want to address it effectively, we also don't want to create sense of shame and guilt around it. Shame and guilt cut people off from seeking treatment. So part of what we're going to talk about, including how you might interact with your students, would be not to judge or stigmatize substance use, and not necessarily to treat it since that's outside of the scope of the coaches, but rather to at least have that perspective to say, this is a person who is struggling with an issue. I want to treat it with compassion. I want to treat them with dignity, but also know that in certain circumstances as a coach, I have to set clear boundaries and be very clear about what I'm seeing. Substance use disorders in adolescents and young adults. So here's some recent statistics from the National Center of Drug Abuse Statistics. Early drug use correlates with substance use problems later in life. Prolonging abstinence from substances through the age of 26 can nearly eliminate the potential for a substance use disorder developing later. So 26 is kind of this age that we hear a lot about, right? It's the age in which the sort of brain forms, in which young people become adults and can start to make better decisions, think more into the future, weigh risks a little bit more. It's also this time through studies that they found that if you can prolong abstinence or at least mitigate substance use through the age of 26, you can really eliminate the possibility of a substance use disorder happening later. And if some parents say, well, shouldn't I prepare my child for college? Shouldn't I prepare them for the social world to have them start to drink alcohol or utilize cannabis? And both the evidence and our answer is no. It's not to say, though, that you shouldn't have fulsome conversations with your children. You don't want any child launching into college having no concept or understanding of substance use. That creates a situation in which they might go full in because they are no longer sort of under the authority of their parents. What you want to do is start having conversations early and often. This is what we say to parents about the challenges that substance use creates for young people, and not overhype it, but again, give them as much thoughtful guidance so that when they do get to college, they can make better choices. Between 2016 and 2020, substance use among eighth graders increased by 61%. 62% of 12th graders reported abusing alcohol. 50% of teenagers report misusing a substance at least once. In a 30-day period, 2.08 million, that's 8.3% of all teenagers 12 to 17 reported using substances. And of those, 1.7 million used cannabis. In that same period, nearly 600,000 teens reported using substances other than cannabis. So what's interesting about these statistics is that there's a lot of substance use happening. There's also a lot of young people who are choosing not to use substances. And I always like to frame this data that way, that there's a lot of teenagers who are not using in a 30-day period or at all. And that I think is heartening. But it doesn't, of course, mitigate, I think, the challenge that the substance use that's happening with the teens who are using and the issues that that can create. So etiology and comorbidity, there's research that indicates that children with limited adaptive coping skills are predisposed to substance use. Identifying and treating issues like anxiety, depression, and learning issues can prevent children from self-medicating with substances when they hit the crucible of adolescence. And I use that word crucible like pretty literally. Adolescence is a tough time for any kid, even a kid who's neurotypical and has a really good support system around him. When you throw in something like neurodivergence and learning issues, right, along with other challenges, including the social challenges of school, that creates a situation where when they have access to substances, so around eighth grade, you can start to see substance use increasing for those kids. Measures to treat conditions like ADHD can help mitigate the use of substances to manage the neurocognitive and emotional responses to that condition. So there is evidence to suggest that when you properly medicate ADHD, you can mitigate the self-medication that would happen if it's not properly medicated and treated. Substance use treatment, like the model used at NYCFL here, can also help prevent and or treat substance use issues. We do a lot of preventive work with our youngest clients who are 13 and 14. So some approaches that we use, and I won't spend too much time on this, is DBT, which is kind of a combination of CBT and Zen Buddhism, plain old cognitive behavioral therapy, motivation enhancement therapy. A lot of young people are not motivated to stop using, and we seek to create motivation by using a specific kind of rhetorical framing in our conversations with those young people. We love yoga, meditation, and sober outings. There's 12-step and smart recovery, and psychiatry. There's a place for medication and psychiatry in this work. I'd say a pretty big place, especially when the substance use is self-medication for mental health issues. We want to treat those effectively with FDA-approved, evidence-based medications, and not with self-medication through cannabis or other substances. So we're getting to the end of my slides, and I just wanted to throw out some questions and maybe see if some folks wanted to, put forth some answers to these questions. The first question is, what comes to mind when you think about someone with a substance use disorder? And as honest and open as folks can be, like what are just the words or the feelings or the thoughts that come up when you think about someone using substances? Anyone? Yes, Victoria.
Family history.
Yes, family history. We ask a lot about family history and whether or not there was a family history, both historically and present, that has substance use, right? There is both a biological and genetic, but also sort of a social, familial link to substance use. Absolutely. What else? Julia says, I think about someone struggling. Oh, let me pull up the chat. Think about someone struggling with no other solutions or strategies available to them that they are aware of. Sure. Yes, I think that absolutely, right? When we think about substance use, we can come up with someone who's struggling and someone who's maybe having a difficulty figuring out what other ways they can use to address what's going on. Here's the thing: people use drugs because, in a perverse way, they work, right? They do something for somebody. If they didn't do something for somebody, people wouldn't use them. Now, our argument, right, and often the evidence suggests that it's a poor coping method. It's a maladaptive coping method. And so what we want to do is, in a program like this, is give folks more healthy ways to manage their challenges, right? So instead of going to the bottle, instead of going to the joint, right, they're utilizing other more healthy activities to manage the challenges that they face. Anything else? Victoria, you have one more thing?
Yeah, well, I think it's helpful that the group that is talking right now, we have this kind of background knowledge of not blaming the individual and really helping to be, that support there. Whereas sometimes the parents, and I'm saying this from the perspective of hearing the parents often talk about it, the parents are like, I don't understand why they can't just stop. It's really weak of them to not be able to do it, and it's a pity that they want to ruin their lives like this when it can be out of their hands.
Yeah, I think that's a very good point, right? And so that parental stigma can be difficult because what we want is young people to step up and talk to their parents about their issues, right? And we want parents, and a lot of the parent coaching I do is around parents destigmatizing their language and responding to their kids in ways that open up more dialogue and more conversation rather than shutting it down. I see Lana and then Sam. We have a couple more things coming through. Okay, so Lana, let's start with you.
I was gonna say I automatically think, what are the causes and triggers? Like, what are the underlying causes?
Yeah, and that's a really important thing. Understanding triggers from a therapeutic and from a provider's perspective, but also having that young person understand their triggers. Because once they do that, and this is a little classic CBT, right? Once they understand those thoughts and those feelings, they can then interrupt them and figure out what adaptive or healthy things they can do as opposed to using substances. Samantha.
It's interesting, and I'm glad that Victoria went and then Lana went. So I'm coming from the perspective of both a coach and a parent.
Mhm.
And when my coach's hat is on, it's all about trying to figure it out, like, and like Victoria said, our job is non-judgmental, analytical, figuring out, right? Like, how do we help? What is going on? It's very, kind of mirroring what Lana said, like, what are the underlying causes? What's going on? How can we help? But then when I put my parental hat on, because that emotional connection throws all of that out the window, and everything that comes in is what did I do wrong?
Mhm.
What, right? Like, why is this happening? What could I have done differently? Shame, guilt, right? Embarrassment, all of that stuff. So it's such a fascinating conversation from both the perspective of a parent and a coach, because you know both sides of it, but your response to it, depending on what hat you're wearing, is very different.
100%. And in fact, so much of the advice we give to parents, but also I would say that we give to other helpers, is that we need to cope and manage our own emotions and reactions when we see, hear substance use or other challenging things from kids, right? Is immediately so one is about modeling our own coping skills and then using those coping skills. So yes, when your child or the young person who you're coaching brings something to you that's challenging, you can take that deep breath, you can do the things that you need to do coping wise to show up for them in that moment. And so, the for parents, it's particularly challenging because it's also wrapped up in our capacity as parents. Are we doing the best job we can do? Right. And I think that that's probably true for coaches as well. Right. Am I doing everything I can do to support this young person? Who's here for me to support them in one way or another. Joanna or Johanna or Johanna said coping skills and trauma, self-medicating, cognitive and mental health symptoms, undiagnosed health issues. So I think what I'm hearing from this team is there is a pretty robust understanding that substance use has diverse origins with people, but that those origins are functionally about a person's desire capacity to manage and address these things, even if it's again not in the healthiest way. So this is helpful, right? No one has said people use substances because they're a bad person, because that's not the case, right? People have inherent value and inherent worth, and they struggle with substance use, and we want to show up and support them as human beings, as people, to help preserve and amplify that dignity. So question out, Lana, did you have one more thing you wanted to say? Okay, your hand was still up. So question.
Sorry, I'll remove that.
No worries, no worries. I just want to make sure everyone has a voice here. So what is stigma? Can someone give me an answer? And if you need to Google it, that's fine. Life's an open book test, in my opinion. Ooh, anyone. Ah, Joanna said preconceived judgment. Yeah, that's a pretty big component of it. Absolutely. Well, I'll just go on and say, oh wait, Jennifer's writing something. There's a lot of anticipation here because I see the dots. I think, did someone else also raise their hand while Jennifer's speaking?
You have Lana. Lana raised her
Lana,
hand.
go for it.
We're on the topic of what's stigma.
Yes.
So it's just preconceived notion, stereotyping.
Yeah, one that sticks and follows the person problem, unfair judgment. Absolutely right. So stigma, right, is the mark, right? The mark of something. So we are disgrace judgment. So we are not seen as people with inherent dignity, right? But we are identified by our problem, and that problem is given a kind of moral dimension, and that's a real barrier. That's a real challenge. Would we agree that people with substance use disorders face stigma? Yeah. So again, our job as helpers, right, whether in the capacity of actually, addressing specifically substance use disorders, or for coaches who are working with young people who might present with substance use issues, right, our job is to work through that stigma or any feelings we have that might create that stigma, and see that person with inherent worth and dignity and worthy of treatment and support. My sense is that this is a bunch of folks who already have some of those ideas. And again, we all struggle, I think, with our beliefs. And so we have to be very honest and open about them and work through them and process them so that we can show up for people, right? It's a little bit like what Samantha was saying with respect to kids, right? We have to learn to manage our feelings around certain things so that we can show up in the most effective way possible. And that word effective is one that we want to keep coming back to. So I guess I just want to ask one more question before we sort of move on here, which is the last one. Are there examples of stigma that we can identify, including conditions of populations who have overcome stigma? So aside from folks with substance use disorder, what other populations or groups of people do we think have experienced stigma because of maybe a condition that they have? Leslie.
I mean, a lot of the clients we work with are on the autism spectrum, and they definitely face stigma.
Yes, absolutely. That's a big one, right? And I know a lot of the language is moving from sort of awareness to acceptance and creating a world that is friendly and welcoming for people who are neurodivergent, right? It's not just tolerating or accommodating, but it's actually a feeling of integration that's so key. I see mental health, religious neurodiversity, obese individuals. Absolutely. Those are great. Immigrants, yeah, absolutely. I'm also thinking too about, growing up during the HIV/AIDS epidemic and how we as a society really stigmatize folks with HIV and AIDS. And still, I think that's an issue, although I think more and more we've seen LGBTQIA, absolutely, chronic illnesses. These are places where, again, this like social movement and our capacity to engage with those people, including people who have substance use disorders, allowed us to see them as people with inherent worth and dignity, regardless of what they were going through. So I bring this up because that creates the frame and the foundation by which we can show up and support people in the most effective way, by undoing or seeking to undo as best we can those areas in which we either contribute consciously or unconsciously to stigma. And substance use is one key place. I'm not done with my presentation, although this is my information. We're on the same page there. What about when there's a fine line between using it as an actual coping mechanism and when someone begins to use it? And so that was actually a question that came up, and maybe I'll go back to my notes on that one because I think I wrote something about that. Let me just. So one of the questions that came through was, is there a line between where self-medicating is helpful and harmful? And is there such a thing as casual use? And I want to maybe take those two questions, one of Jessica's and that, and sort of kind of address them both at the same time. Self-medicating with drugs and alcohol is harmful. This is true across the lifespan. Mental health issues, behavioral issues, and issues of neurodivergence can be addressed with safe and evidence-based treatments and interventions provided by trained, licensed, and experienced providers. When someone becomes their own doctor, especially with drugs and alcohol, it often leads to very bad outcomes. And for adolescents and young adults, substance use can contribute to a number of physical, psychological, psychiatric, and neurological conditions. We see an emergence of psychosis with cannabis use. We see this thing called cannabinoid hyperemesis syndrome, where the high concentrations of THC cause uncontrollable vomiting. We see that a lot more now. With and those come a host of issues related to a sense of self and relationship to others, which is to say that aside from the psychological and neurological issues, there's also the way that substance use interrupts natural and healthy development with respect to the sense of self and relationship to others.
To ask any questions that we might have. So Geoffrey, feel free to take it away.
Thank you, Leslie, and thank you, Samantha.